So for today's session 1, we'll be covering more on gaining body awareness. And then specific for mothers, I like to focus a bit more on pelvic floor exercise. You need a little bit more information about pelvic floor, how the pelvic floor looks like, or the pelvic floor anatomy. Please refer to a separate video on this. And generally, pelvic floor, the perineal muscles is located between the space of your anus and the genitals. So by lifting the pelvic floor muscles up, perineal muscles up, is basically to feel that you are lifting and controlling your natural urges sort of feelings, like you're holding your urine up sort of feeling. And then you release it. This very simple pelvic floor exercise helps to strengthen your pelvic floor muscles, which are weakened by the weight of the baby pushing down into the pelvis. And the pelvic floor supports your entire spine and also your internal organs. Therefore, it's a very important exercise for all mothers to perform, and especially so after delivery. So we'll right now do a few Kegel exercises. I'm just going to give verbal instructions. As I say inhale, you're going to relax the perineal muscles. As you exhale, you're going to lift the perineal muscles up and all the way to the heart as high as you can. So just visualize using your mind's eye. As you inhale, relax the pelvic floor. And as you exhale, lift the perineal muscles up high towards the heart. And inhale, relax the pelvic floor. Exhale, lift the perineal muscles up. Inhale, relax. Exhale, lift the perineal muscles. Let's do 2 more rounds. Inhale, relax. Exhale, lift. When you're doing the pelvic floor exercise, I shouldn't be seeing any movement. There shouldn't be any movement in the hips at all. So inhale, relax. And exhale, lift the perineal muscles up. Good. So that is something you can do anytime, anywhere. You don't have to specifically go to a class to perform the Kegel exercise. You can perform it even while waiting at a queue, standing or sitting, watching TV. So a very convenient exercise to be performed anytime, anywhere. The next thing we're going to work on is your limbs. So most mothers tend to experience edema or water retention in the legs. So during prenatal pregnancy, the blood flow in the body tends to increase due to the changes in the body, hormonal changes for the additional little baby under your belly to grow. So I'd like you to first stretch your legs out to the front. Very simple leg exercise. So important thing for most people is that sometimes we don't really gain that, we're not aware of certain parts of the body. So by performing exercise, I'd like you to use your mind's eye to really bring your awareness and attention to the areas they're working on, cultivating a little bit deeper sensitivity to how you feel in each part of the body. So first, you're going to point your toes and flex your feet. Point and flex. Point and flex. Do a couple more rounds. Point and kick your heels away as much as you can and try to bring the toes to touch the floor as you point and flex. Good. And now you're going to rotate your feet in a clockwise direction. So continue to move, rotate, draw very, very, very big circles. You want to feel your feet moving from the ankle joint. And this might be a very simple exercise, but it really provides good benefits to your whole body because most of the energies get trapped in the joint area. By loosening up energies along the joint, you're actually facilitating blood flow and chi flow to the vital organs in the body. And once you're done, moving to the opposite direction, counterclockwise. You can do 5 rounds on each side. If you have a bit more time, you can do 10 rounds. When you're watching TV, you can also do this. Very simple. And once you're done, begin to relax. Good. And now we're going to just cross your leg. Continue to keep your torso upright. And now, as you keep your legs crossed, extend one leg out, bring your left leg forward, and bring your right leg up on top of the left. So now we're going to just work on your hips. As you inhale, bring your knee up. And as you exhale, gently push your knee down. So left hand is holding onto the right ankle, and right hand is on your right knee. Inhale, bring your knee up. And exhale, lower your knee down. Just a couple more rounds, just to mobilize your hip a little bit. And one more. And very slowly begin to release your legs, switch leg. Bringing your left ankle onto your right thigh, right hand onto your ankle, left hand onto your knee. Inhale, bring your knee up. Exhale, lower your knee down. Inhale, knee up, flowing the breath. Exhale, knee down. Just one more. Inhale, knee up. And exhale, knee down. And very slowly release your legs and stretch your legs out. And another thing I like to do is on the wrist. So some mothers experience some wrist problem or carpal tunnel syndrome. So doing, again, simple wrist exercise actually help to improve the blood circulation to the wrist as well. So hold on to your left wrist with your right hand and start to rotate your wrist in clockwise direction and also counterclockwise direction. You can do 5 rounds on each side. Once you're done, you can switch direction. And you can move on to the other hand. And once you're done with 5 rounds, you can move on to the other side. Good, and very slowly begin to release. Just press your palms down to the floor, out onto your thighs. Keep your spine tall and erect. So as you sit, I'd like you to feel that your whole body is tall and erect. If you have nothing under your sit bone, it would be good to prop yourself up with a little bit of cushion or something to help prop your hip up so that your knee falls a little lower than your hips. And especially if your baby is becoming heavier and heavier, it's important to have your hips propped up to support the weight of the baby. So as you sit comfortably, keep your eyes closed and bring your awareness towards your sitting bones. Feel both your sitting bones evenly rooted into the support that you're sitting on. And from there, keep your spine tall and erect. Allow your shoulders to soften down towards the waist and feel the crown of the head just above the tailbone. And I'll allow you to bring awareness to your legs and notice, are you holding tension in your legs or are your legs relaxed? And bring awareness to the hips. Are you holding tension in your hips? Are your hips relaxed? And bring awareness to the whole back. Are you holding tension in your back or does it feel relaxed? Bring awareness to the shoulders and hands. Are you holding any tensions in your shoulders and hands or are they relaxed? Just observe, no judging. And bring awareness to all your facial muscles, your jaws, cheek space between the eyebrows. Are they tensed or are they relaxed? Just observe. The more you connect with your body, the more sensitive you are to your body. This will help you a great deal to gain that connect and tap onto that inner body wisdom during labor. So in the next session, we'll focus a little bit more on breath, and I hope you find this session beneficial. You can repeat this exercise as often as you like. Thank you.